My name is George Smith, and I'm an intern at the UT Health Medical and Research Center, and I'm going to be going over the kinematics of the spine. The spine is separated between three regions: the cervical region, the thoracic region, and the lumbar region. The cervical region has 7 vertebrae, which is from C1 to C7. For the osteokinematics, the cervical region permits flexion, extension, lateral flexion, and some axial rotation. For the orthokinematics, from C1 to C2, the convex surface of the inferior occiput condyles are articulating with the concave surface of the right and left zygopopsial articular facets of the atlas. And from C3 to C7, the inferior articular facets of the superior vertebrae are articulating with the superior articular facets of the inferior vertebrae. The thoracic region has 12 vertebrae from T1 to T12. For the osteokinematics, the thoracic region favors rotation with limited flexion, extension, and lateral flexion. It favors rotation due to the zygopopsial articular facets being in the frontal plane from T1 to T6. As for the orthokinematics, the inferior articular facets of the superior vertebrae are articulating with the superior facets of the inferior vertebrae. The last region is the lumbar region. Whereas the thoracic region favors rotation, the lumbar region favors flexion and extension with limited rotation. This is due to the facets lying in the sagittal plane from L1 to L4. As for the orthokinematics, same as the thoracic region, the inferior articular facets of the superior vertebrae are articulating with the superior articular facets of the inferior vertebrae. From articles regarding the kinematics of the spine, I would be using a clinical trial of trunk balancing. The title of the article is "The Efficacy of Trunk Balance Exercises for Individuals with Chronic Lower Back Pain, a Randomized Clinical Trial." The clinical trial was from the Journal of Orthopedic and Sports Physical Therapy, published on August 1st, 2011. The objective of the clinical trial was to determine whether trunk balancing exercises are more efficient than straining exercises with patients with complaints of chronic lower back pain. The clinical trial consisted of 79 adult patients with chronic lower back pain. They were each divided in 2 groups: an experimental group, which would be using trunk balancing exercises with trunk flexibility, and a control group which would be using straining exercises with trunk flexibility. Patients will be performing 2 sessions a week for a total of 10 sessions in 5 weeks. The results will be measured by pain intensity using a visual analog scale, disability, which will be using the Roland-Morris questionnaire, and quality of life, which will be using a short form health survey. For exercises in the experimental group, they will be consisting of 2 sets of 30 seconds of kneeling thoracic rotations on a pillow or an AirX, arms adducted at 90 degrees, 3 minutes of kneeling shoulder flexion extension with head movement, same on a pillow or on an AirX, and 1 minute each of bird dogs. In the control group, they will be consisting of 3 sets of 6 of abdominal curl-ups, 3 sets of 8 of shoulder extensions at 50% maximum contraction, 3 sets of 8 of seated hamstring curls at 50% maximum contraction, and lastly, 3 sets of 8 of seated knee extension at 50% maximum contraction. As for the results, in the pain intensity, there was no significant difference between the 2 groups. In the disability, the difference in the RMQ score was significantly better in the experimental group. And in same for the quality of life, the difference in the quality of life was significantly better in the experimental group. In conclusion, the clinical trial was a success and showed results in favor with the experimental group, which were using trunk balancing exercises with trunk flexibility. In a clinical setting, when faced with patients with chronic lower back pain, it is beneficial to incorporate trunk balancing exercises as opposed to just straining exercises.